All right, it's so great to see everyone. My name is Farrell Karitzis. I am the director of the UF Center for Arts and Medicine, and we are delighted that you are joining us for the first webinar in our Arts and Health webinar series. Today's webinar, Arts and Health, Defining the Field, Finding Your Path, will offer an overview of the field of arts and health and explore career paths through a moderated Q&A with our panel. One of the most frequently asked questions we receive is what career options exist in arts and health? This series is designed to illuminate all the possibilities. Those working in the field have a wide range of educational backgrounds and experiences, making the field of arts and health truly interdisciplinary. In future webinars, we will explore specific areas of the arts and health field more deeply, so please sign up for the Arts and Health Today newsletter to find out about the next webinar and the latest news, research, and opportunities in arts and health. Before we hear from our panelists, here are a few reminders. Live closed captioning is available. If you'd like to use closed captioning, hover over the More button at the bottom of your Zoom screen and enable captions. Today's webinar is being recorded, and the resources mentioned during the webinar will be emailed to all registrants. Lastly, please feel free to use the chat to comment and share ideas and relevant resources. If you have questions for the panelists, please use the Zoom Q&A feature, and we will get to as many questions as we can during the Q&A portion of the webinar. Now, I'd like to introduce our webinar moderator, Natalie Rella, who will introduce today's panelists and begin the conversation.
Hello, everyone, and welcome. Oh my gosh, it's so cool to see people coming from all over the country and the world. We've got someone from Ireland, Greece, Australia. This is incredible. Welcome, everyone. Welcome, and I'm delighted to be here today to discuss something near and dear to my heart, the growing and expansive and incredible field of arts and health. And to be able to talk about this field with some colleagues that I respect and also hold dear to my heart. So when I think about arts and health, I think of it as sort of this umbrella field under which there are several sort of sub areas. So arts and healthcare or clinical settings, arts in the public health and community settings. And then we've got the arts and health research and evaluation side. And of course, there's now arts and health teaching and academics and administration. So we hope that this panel, we have curated some questions that will dive into a conversation, a pointed conversation that kind of takes us down these different roads and illuminates ways in which these folks show up and arts and health shows up in the world and our communities. So without further ado, I'm going to start introducing these beautiful panelists. We've got Heather Spooner. She is an associate scholar of arts and medicine and a faculty member at the Center for Arts and Medicine. She's an art therapist who's worked at the intersection of creative art therapies and arts and health throughout her career. And we are welcoming her. We're very excited to see you here, Heather. Yay.
Thank
All right,
you.
next up, we've got, welcome, thank you. We've got Cassie Belden, is an alumna of the University of Florida Center for Arts and Medicine. And she now serves as an adjunct instructor with us and as an evaluation and research specialist with our sister program, the UF Health Shands Arts and Medicine program. Welcome, Cassie.
Thanks, Natalie.
And next up, we've got Alexandra Rodriguez, also an alumna of the Arts and Public Health Graduate Certificate, and now a research associate with us at the Center for Arts and Medicine. She is an interdisciplinary researcher and a public health PhD candidate at the University of Florida Public Health and Health Professions. And she is focusing on social and behavioral sciences, is dipping her toes in the policy space. So we're excited to have you here too, Alex. Welcome.
Thank you.
I wanted to also give a quick note. We have some folks in the background that you can't see, Andres and Brandon, and they are behind the tapestry. They will be fielding questions and comments and sharing links in the chat. And if you miss a link or if you miss anything, fear not. We will be following up with an email with a recording of this, as Farrell mentioned, and all the resources that we mentioned. And we do invite you to share resources that you have. We value collective wisdom. And so please, any resources that are relevant to this conversation or beyond to the field of arts and health, please in the chat. Okay, shall we get your notebooks ready? Get your taking devices out and ready to go because we are about to get this conversation started. And help and start with Heather Smoot.
All right. Yeah, I think of art health as being really broad. Just all of the ways that the arts and creativity can support our health, our well-being. The network called Creative Forces, which is the National Endowment for the Arts Military Healing Arts Network. And that includes a clinical component. So we have art, music, and dance movement therapists working in VA and DoD hospitals and working on clinical goals. We also have a whole community program where people can expand. A lot of times they start doing therapy and they don't want to leave because they love the art so much and they get so much benefit from it. And so really we want them to get out into the communities and work with artists and meet people where they're at. And oftentimes we're working in partnership to allow that to be a big part of the work that they do. And I just love getting that whole breadth as part of my own work too.
Awesome. I love to hear it. And could you just talk a little bit about the difference between art and creative art therapies and arts and health? Sort of give that a clear differentiation.
Yeah, so we're talking about creative arts therapists. There's different disciplines. There's art therapy, dance movement therapy, music therapy, but those are people who are clinicians. So they have a registration, a board certification process. They go for higher education. And what they're primarily doing is using art to work towards specific goals. So they'll be using the art, the music, the dance, really for things like cognition, working through trauma, which is a bit different from what a lot of the artists in arts and health is doing, which is a bit more broad than that. Sometimes you do see examples where somebody's working towards a goal and they've done that with a clinician. I think of things like Dance for Parkinson's, where maybe you do have dancers who have worked with clinicians to come up with a process that really does help towards those goals. But a lot of what I see in arts and health is people just recognizing there's power to art and creativity in itself, right? There's something about that that really does change people's lives in really dramatic ways. And sometimes to not have to focus on the goals and just get to engage with that creativity can be really powerful in a different way.
Thank you. Thanks so much. All right, Alex, how about you?
Yeah, thanks. And I think Heather really explained it beautifully. I think I also think of it as a continuum, kind of what Natalie was referring to in the beginning too, of being from clinical healthcare settings all the way to everyday practices and much more community-based public health work. So a lot of my work actually stems from the public health space. And so I think a lot about how arts engagement can help to create safe spaces, can foster health communication. And more recently, we've been really trying to position it as a health behavior because of all the evidence we've seen for health benefits as well, specifically as it relates to well-being, especially, but there's quite a gamut of evidence out there as well. And I've been really honored to be part of the lab for the past 5 years now. I did my graduate certificate in arts and public health during my master's, and I think getting to be a part of the center has really allowed for me to not only understand really intrinsically what I had already come in understanding, but understand kind of the mechanisms and the ways in which we can study this and mobilize this work and influence it further. So I've been really excited to be in this space and kind of be on the public health side and to learn from a lot of my colleagues who are a little bit more clinically focused as well.
Thank you. All right, Cassie, what do you have? Anything more to share, expand upon?
Yes, so much. Thanks, Heather and Alex, for that. You've set it up beautifully. I think that me coming into the field of arts and health, the vastness of the field is what made me so excited. Coming in as a visual artist first and foremost, and just thinking about how that vastness really plays to the limitless nature that arts and health generates. So I think collaboration is a really important word for the field and defining it, and how so many of us are coming from different sectors to leverage the arts together, and really using the arts and artists as a center focus for how well-being and connection, resiliency, advocacy, et cetera, can be promoted by the arts, and we all work towards that together. And I think what feels really good about it is that no matter where you're coming in from the arts, creative therapies, public health, healthcare sector, policy, government, beyond, I think everybody has a space here and everyone belongs in this work if you want to be in it. And there's so much space for creation and limitless possibility. So that's what I'll add to Alex and Heather.
I love that. I think that's a really important point, is the sort of intersectional nature of interdisciplinary, but also cross-sectoral nature of this. So you can have folks who work in public health partnering with arts organizations to bring about programs. You don't have to be an artist, or identify as an artist or be trained as an artist to do arts and health work. It's really truly multifaceted. And okay, so we've been talking a bit on the like abstract level about what arts and health is. I'd like to get us grounded in some program examples. So Heather, maybe you can start us off and share an example of an arts and healthcare program, or in a clinical setting, maybe a little bit more deeply, that you've been a part of, and what impact it had on patients and providers.
Yeah, I think a lot of the work we've done has really been collaborations. And so it's almost hard to even say that it's all healthcare, all community, because a lot of what we do is to explore that whole spectrum where can we partner with artists in the community, maybe bring them in and co-lead a group or do something with us in the healthcare setting, maybe go back and forth between the two. One of my favorite examples of this that really became a beautiful project was I had a veteran who came in and wanted to do a quilt about her trauma experience. And I know nothing about quilting, even though I'm an art therapist and would have loved to support that. But I was honest, I was like, I can help you think through kind of how to do that. I can help you to think of how to express those emotions. I know about art and composition, but I cannot help you with that quilting piece. We're going to have to figure that out. And she went out and she found a group of quilts, like a quilting circle. And it was such a powerful part of the experience for her because they were just doing like traditional quilting patterns. And they didn't know what to make of this person coming in and doing this big piece about all of her trauma in the military. But that was part of that therapeutic process. She would go back and forth, she would meet with them, and she went from not being able to talk about her experience at all to suddenly being able to share because she was spending this time with them and really working deeply, and they were helping her so much. And eventually that piece she worked on for over a year went on to be in an international quilt festival, and she talked about her experience on stage. But had she not worked with
Oh,
that
wow.
artist who really supported her alongside the work I was doing in the clinic, I don't think that ever could have happened. And so I really love the way those partnerships can really expand what people do on both sides.
Incredible. What a story. Okay. Cassie, do you have anything to share in the clinical space?
Absolutely.
Anything more? Yeah.
Yeah. So I work at UF Health Shands, and right now I'm mainly doing evaluation and research for all of the different practices that go on throughout the hospital space. So we have visual artists and dancers, literary artists, music, and beyond. And so not only that, but I get to sometimes facilitate my own visual arts practice with patients here, since that's the root of my work. And so getting to operate this clinical space as an artist has been really, really rewarding, and comes with so much new knowledge about how to incorporate yourself into that space with people, and really just rolling over that nature of caretaking and being there for people, especially at the bedside, and caregivers and families as well. So incorporating myself and my rooted work into this space in a large clinical organization has been really special. We have had some arts prescribing pilots that go on the last year with youth mental health and sickle cell. So we've been using and leaning on our healthcare providers to help us with referrals to some of these pilot programs that we had going on. So getting to see youth work with visual arts to combat mental health adversity, and setting up music workshops with sickle cell patients has been a really special experience. And I can always share more about that or resources about it.
Awesome. Thank you. All right. How about you, Alex? Anything to add to this?
Yeah, so I think a really neat public health focused example that we engaged in a few years ago through the center were several field guides that we published with the CDC on how the arts and artists can be partnered with in order to help promote vaccine confidence amongst under-vaccinated communities. And it was a really, really neat initiative. 2 field guides came out of it. And I can drop the link in the chat in a moment if anybody is interested in checking those out. But what was also neat about it is afterwards, we actually received funding at the University of Florida. So I was able to lead a study here where we partnered with muralist Jenna Horner locally. And we actually had mural installations across the University of Florida campus and had QR codes. And we were really trying to get people access to information that was reliable and information on where they could get vaccinated locally. And then from there, we actually also partnered with UF Health Street and had activation sites at each of the mural sites and offered flu vaccinations, COVID vaccinations, as well as opportunities to speak with a physician about any questions they may have, or if they would like more information on vaccination. And it was a really great opportunity to really, again, have this form of cross-sector collaboration around a singular goal. And I learned a lot from it. Actually, the mural study that we did in Gainesville was based off of something that was larger scale done by the CDC in Atlanta and Living Walls Atlanta, which was really neat that they did across certain boroughs, and they would have artists from those boroughs be the muralists as well. So that's just one example of work that we've done, but we've done a lot, including some of our work with One Nation, One Project Arts for Everybody campaign more recently. So that's been a large 18 city cohort project where each of the communities have brought together municipal leadership, artists, and public health practitioners to really hone in on a hyper-localized public health issue and trying to understand how these sectors could come together and leverage the arts and really mobilize the arts as a partner in this work to address some of these concerns locally. So happy to talk about that more in depth as we go on.
That project is a really good example of the cross-sector possibilities. 18 cities around the country, working with not just artists and arts organizations, and public health folks, but like municipalities, like the government was part of the activations and the dreaming of what it could be like, or what it could look like. And in many of those cities, there's still the collaborations continue. So it was a, time limited experience, but because of the collaborations that took place. And maybe Andres can drop the Arts for Everybody website in the chat so they
I put it in there
so that everyone, okay, great.
Yep.
To just check out in detail. I mean, it's incredible work. And Cassie mentioned arts prescribing. I think it was the site in the Bronx started an arts prescribing program in the Bronx based on their experience with Arts for Everybody, One Nation, One Project. And that's just one city, of the 18. Every city was impacted. And the beauty of it was that cross-sector collaboration that led to sustainable partnerships. And this is what's possible. Okay, Cassandra, Belden, would you like to add anything? Any from the public health space or your experience with One Nation, One Project? Any examples that you'd like to share?
Yeah, oh my gosh, I could go on. So I'll try to keep it short, but I worked alongside Alex as a research and impact, a national research and impact associate for One Nation, One Project. So I was a part of a lot of the focus groups that took place between community members that were putting together these large scale participatory art projects throughout each city on the same day, July 27th. So they were all getting together and figuring out how to navigate all of these municipalities to put on something that addressed a unique public health issue in their own area. So just getting to communicate with all of these different people in different cities and hear about how they were going to use the arts to promote advocacy for these issues that go on all throughout the nation, you know, in such a time where we need to lean on each other, um, you know, to get through some of these epidemics that we face. So uh, they were all working to promote or answer a prompt, no place like home. So that was really special to see how everybody came together to use the arts to answer that question. And yeah, like Alex said, they were all different. Gainesville and Kansas City focus on youth mental health, Honolulu, cultural resilience, etc. So it was really, uh,
Yeah.
yeah.
I would just echo the really special part about a project like that, or a arts and health project in general, is that you can and should work with the artists and community members to identify what it is that their needs are, and the artists as the translators of the information and the ability of artists and culture bearers to bring communities together and focus in on a health priority. One Nation, One Project was an exemplar of how it can work. And it was really neat to be a part of. And I encourage all of you to not just explore the website, but explore the research briefs, because those can give you a roadmap to making it happen in your community. And we can also share those in the epic follow-up email. But there are, I think, 6 research briefs that go into how things were executed, and then like the evaluate like the findings and results of it. Yes, Alex, with those links coming through. So okay, that's good. So good. All right, speaking of research and impact, let's move into this space. Alex has been digging deep along with Cassie and Heather. All 3 of these ladies are research brains as well. So let's talk. I'd like to start with you, Alex, about, because you did publish a paper about arts participation as a health behavior. Yes, I said it, folks. When you engage with the arts, it is a health behavior, like eating vegetables, wearing a seatbelt, moving in your body. It is good for your health, right? In all sorts of ways. So maybe we can drop a link to that paper, but I'd like to hear you talk a bit about that. Dig a little deep. What can you tell us about the health benefits of engaging with the arts?
Yeah, thanks so much for that lead in, Natalie. Yeah, so what's been really exciting is really for the past 20, 30 years, we've really been seeing a surge in research at this intersection and really formalization of the work at this intersection, even though we recognize that historically this work has been done for hundreds, if not thousands of years, especially as it relates to indigenous practices. But more recently, we've been able to really garner some epidemiological evidence. So evidence from large cohort studies to really show the benefits of engaging in the arts, as well as long-term benefits on health. So some of that data has actually come out of our EpiArts lab. And so we've seen that from these large cohort data sets, engaging in the arts can lower risks of developing depression, cognitive decline, chronic pain, while also supporting psychological and social well-being, which really has huge impacts. And I think another really exciting aspect to arts engagement that we've been seeing in the literature are also the benefits to social connection. And so given the loneliness epidemic, which was declared by the Surgeon General here in the US, as well as given the recent priority from the WHO as it relates to the importance of social connection for health, I think that there's really an opportunity here for the arts to be a solution and a collaborative solution to a lot of these needs that we're currently facing. And as it relates to the paper, I think what's really interesting and exciting about some of that work is that by creating this framing of arts engagement as a health behavior, we're really able to have people understand kind of quickly what we mean when we're talking about arts and health. And we're also putting it alongside other behaviors that are recognized by the field of public health as health behaviors. So things such as exercise or nutritious diet. And it actually wasn't even until 2007 that the Exercise as Medicine initiative in the US took off. And in 2010, the first WHO population-based public health guides for physical activity were published. So I think we have a lot to learn for how we can mobilize arts engagement as a health behavior in receiving some of those same type of acknowledgements as well as structural developments. But I think that we're really at a great launching point, and we're building on the evidence we do have while continuing to mobilize evidence as well. So yeah, it's an exciting time for this
Great.
space and exciting time to be here.
It really is. And I'm going to piggyback on that because we actually, the Center for Arts and Medicine, just today had a paper published in Nature that talks about the use of the arts, leveraging arts-based programming for non-communicable diseases. This is huge. That makes up like 74% of preventable deaths. And we can put the arts to work as a public health tool. What this paper shows is that it is an effective public health tool for reducing non-communicable diseases. So I invite you to check that paper out. And there's also the UN General Assembly Arts and Health stuff happening next week in New York. And the, non-communicable diseases is going to be a big part of that, of that work. So get in it, check it out, bring it into your work. If you work in the public health or healthcare space, we need you. We need you to bring the arts with us, with you. Bring us with you. All right, Cassie, do you have anything to add?
On the research front?
On the research front.
Yeah, so yeah, a lot of what I'm doing here right now at Shands has been primarily evaluative work of really seeing the impact of how far and wide our artists spread across the clinical space. So just taking all of the data that we're able to collect through the year, which is different artist notes and numbers, monitoring what people were visiting at Shands. So ages and different health qualities and modalities being used. So we're able to take this really large lump sum of data and create something that we're able to share and help our workers here at Shands Arts and Medicine feel proud of what's going on throughout the clinical space, and getting to report widely on that and sharing this work that we do. I think that with research heavily in policy and public health and some of these initiatives that we're pushing forward, like social prescribing, arts prescribing, it's really important to stay centered with artists at work as well, and uplifting the work that's being taken place person to person, what's really going on face to face. And I think that's where my intersection with visual arts and caretaking across spaces really blends well with the research space. I think that being an artist is what has made evaluation research feel so second nature. Being able to, I think, at the helm of it all, just wanting to have people feel peaceful and comfortable and invited into a space makes me very detail oriented in something like the IRB process, or creating consent forms, making sure people feel protected and safe and heard and seen throughout the entire process, as well as, my own path in artistry with being exploratory. I think that combining and reimagining frameworks or methodology, all these different things that we use to curate a research or evaluation path is something that I lean towards on my visual arts side and being exploratory in those things. So I feel like following your spark in this space of evaluation research has been really special. And just understanding that nothing has to have a direct line. It's really your lens that you're putting onto this work in your own intersection. So I think it lends a lot to your own personal values as well. And I think that when those values are aligned with your truest self and a mission, I think that, you know, you can really find yourself in spaces unknown. And even if that lands you
Mhm.
in evaluation research as an artist, like what? I would have never, you know, imagined that. But I think that all of those processes, they can really be used wide scale to discover and advance the things we believe in.
I love it. Wonderfully stated. All right, Heather, how about you? Are there particular health outcomes that stand out to you in some research that you've conducted or your own experiences?
Yeah, Cassie, I'll tell you, even as an art therapist, going in knowing I might be doing some more clinical work, I never thought I would get to do the kind of research that I get to do with these partnerships. And so much of it's partnerships, like you've been talking about, Natalie. I know with Creative Forces and having support of the National Endowment for the Arts, there's all kinds of research on the healthcare programs that we have with veterans and service members. A lot of that's showing how they can help to regulate pain, work through, regulate emotions, work through trauma, help support their pain, improve focus and concentration. There's a whole inventory of that research that's publicly available. You can find online. We're currently doing some brain imaging research with the University of Florida. So through the Department of Psychology, we've been able to do some fMRI studies on veterans before and after they go through the art therapy program. And that is still not completely finished, but starting to see some exciting results from it, and something, again, that I just never thought I would have the opportunity to really do and know I could not do alone. I think the other side of it, though, is sometimes the things that you really see as being the most impactful to the people we work with aren't the things we expect, or aren't the things that sound as flashy, right? I know when we first started our program, there were all the things we thought we would see based on the research and what we had looked up and clinical outcomes. But when I would sit down and talk with a veteran, sometimes they would just have the most insightful responses. And one that really stuck with me was a veteran talking about how he used to walk outside every day and just think about all the work he had to do. I need to cut down that tree. I need to do this. I need to do that. And we get really stressed out just thinking about all the work he had to do. And he's like, now that I've done the art therapy, sometimes I just walk outside and I get lost in the beauty of the clouds and the colors in the sky, right? And it's like, wow, how do the arts do that? There's something about just learning to appreciate beauty that can be so life-changing in ways that I think we don't always think to quantify. And I think that's really important for people to remember too, especially if they don't have the ability to do some of these bigger studies that we're fortunate to be able to do here through the center.
Beautiful. I love it. All right, so let's talk about how people can show up in the field of arts and health. Cassie, you're a relatively recent alum, 2023. What would you say are some first steps that you'd recommend for people that might be new to this work, that may be an insight that you would share?
Yeah, I can't believe it's already been about 2 years since graduation went so fast. I think that, you know, coming into this and not really knowing right away how I would carve this path, I think that the knowledge that I gained from the MA was extremely important. And it kind of was brought to me, it was brought to me in kind of tiers of, you know, different levels of knowledge. There was like what it did for me as an artist, which working for the past decade through museums, school systems, clinical spaces, anywhere, working with anyone from pre-K to hospice. I think that the program really helped me shape how to really stand confident in facilitating safely to almost any population that you know, could put in front of me to work with, tailoring different arts engagements to that population in a meaningful and impactful way, and navigating through different spaces of facilitating that I never knew possible or that I maybe was weary of before. So it really helped me bolster safety mechanisms in my work as an artist. But then, of course, there's everything that I learned from, how to really advocate for myself and the field and learn skills that I didn't know possible for me, like evaluation and research, and grant writing. These are a lot of things that I do at Shands, helping to move programs forward and to keep them in the light. I think so. Just being able to stay grounded and confident in your own ability in this work, the center really helped shape me for that. And being able to talk with all different sectors about this. Maybe before I'd mostly be in front of visual or artists of any modality talking about its benefits to health and where we show up. But now I feel comfortable speaking with people in government. I feel comfortable speaking with healthcare providers and uh, people who have no idea what the field is or how it intersects at all. I feel like it just helped me stay confident in who I was and how I showed up in all of this, and took everything that I loved and wrapped it all into one thing that just keeps growing and growing. So, there's a lot of different opportunities. There's the arts and public health and arts and medicine certificates. I went for the MA because it made sense for me, and helped me with what I wanted to accomplish with the arts. And there's all different primers that take place here in Gainesville and beyond throughout the year. There's the arts and medicine or arts and health intensive. There's the research primer and intensive. So you can kind of get a little taste of all of these things that you might more fully learn in the MA. So I would say above all, just keep carving your own path. No one's looks the same is
Yeah.
the thing. Nobody's path or direct interests might even look the same, but there's just a way to weave what you want to do and what you love into this work. And like I said before, the collaborations are endless for
Yeah.
doing that. So staying connected can be easy to do. Just put yourself out there.
And that's true. Arts and health shows up in so many ways we've talked about. Um, but I'd like to hear also from Heather and Alex, what are some career pathways that you think are promising for someone that's coming into the space, maybe from another career or leveraging their existing talents in this new way? Heather.
Alex looks like she was about to turn off her microphone. I was waiting for her. But before I go in, I just want to build too, Cassie. I heard you mention just kind of those collaborations and communication. And I think that's a big part of like how my entire path has come together is looking for times when you see that spark. Because I know that no matter what we try to go out and do, we're not going to be able to do it on our own. And we have to find that really sweet spot between what our interests are, the things we want to give to the world, and also kind of what the needs are that are out there. And so oftentimes if I had an interest in working, let's say in a hospital, and I didn't know where there was an opportunity, it would be about just going and having conversations with people and looking for that spark, like that person who's super excited about it and has the ability to make something happen. Because if you don't find that right connection, that spark, a lot of times you have to work really hard and it's difficult to make something move. But when you can find that person who's really excited about the same thing that you are and offers something complementary, things just move in such an amazing way and so quickly. And so I want to encourage people, regardless of kind of the paths that are out there, to really also think about what is it that you're bringing? What are the things you care about, the causes? What are the things you see in the world? Because I think the arts can really help with so many broad things and that changes every day, right? We're constantly thinking of new applications and places. I'll talk in a bit about some of the disaster work we're starting, which I haven't heard a lot about arts and disaster before. So just finding that place where your interests are, I think you can create opportunities. And that's a big part of what this field is about. It's really creating. It's hard to find a job on LinkedIn for somebody doing arts and health. It's often about building those partnerships. Sorry, go ahead, Alex.
No, that was beautiful. Thanks, Heather. And sorry to confuse you about my almost unmute. But yeah, just to kind of expand on that. So I guess I can speak from my own perspective and journey and then kind of what I'm seeing emerging. So I'm very much grounded in public health, but my passions, interests, I identify as an artist. So coming to this research space, I feel like I get to show up as my whole self. And that has just been really incredible. And I think Cassie was kind of speaking to that thread earlier. And So kind of being grounded in academically in public health, I think I've seen a lot of opportunity to really bring the arts into this space and to expand the field and to gain greater recognition for all of this work by starting to enter spaces where people aren't talking about this yet, or to the extent that they should be. So I will say, since I'm in my PhD, I'm in my last year, I'm really seeing, I'm focused on the research. That's kind of where my journey is leading me. So there are definitely opportunities within academic spaces for research. But I think what I've been hearing a lot of, I have a lot of arts organizations actually reaching out saying that they are really interested in people evaluating the health impacts of their work now that they're reading some of this literature. And they're like, I think our programs are actually having a lot of these same benefits, and we want to track it, we want to measure it, we want to use it in our grant writing, and also just to understand how we can evolve and grow and best cater towards our priority population. So I will say that even though, kind of as Heather said, there might not be as many really discrete listings, I think there are a lot of organizations who are hungry for this work and hungry to collaborate and understand their impacts. And I think that that's really a skill set that you can really get from the MA here, doing the capstone project and really essentially going through an institutional review board, which is basically the ethics committee, and designing your whole project. And that whole skill set could then very easily be applied into running an evaluations type job afterwards. And I think that there's demand for that right now.
Yeah, I think there's so much truth in that, Alex. I mean, having gone to school for art therapy, where it's like the arts and all the clinical stuff, we did not get any of those things like grants writing and program management and all of those other skills. And I mean, when you graduate, either you try to do it and you do it really badly, or you just don't have a clue, right? And I so wish that some of that had been built in. I think that is one of the real assets to doing this type of a program, is you do learn how to develop logic models, how to support your work, how to get funding. And so you have those tools when you graduate to be able to build those programs and find those jobs.
Yeah, Alex and Heather really built on that beautifully. That's exactly how it feels of just, I always kind of thought throughout my undergrad, I was in visual arts and art therapy. And I kind of thought, why aren't more, maybe some more back of tapestry things included in this kind of learning? I want to learn how to build maybe my own programs, or manage different things, or be able to evaluate, be able to write those grants that help keep this work alive. And I always felt like those pieces were missing for me. That was something that had my heart on fire. I was like, I want to learn how to continue to advance this field in the arts and spaces I believed it should be, like community and healthcare, spaces of care. So I felt like that this programming was the missing piece for me, bringing in all of that time and knowledge with facilitating and being an artist and working hands-on with people. This was another way to ensure that I could be a key piece of improving and continuing that work in the world.
I love this. It makes me think that, there is a really entrepreneurial nature in arts and health, where because it isn't widely known, it's not a ubiquitous concept. A museum may need an artist or someone to walk through the door and say, this is like the research that backs up that this thing works, and that, you could have access to more funding streams if you expand beyond arts and culture into the health and public health space, and vice versa. So I've just, I want to share, we have a research database that has like functionality where you can search for terms like older adults and, dance. And it's just a plethora of data. If you need to support your idea, it is probably there. If you have a spark of an idea for your community, get the data to back it up in that research database. Okay, we are running out of time. All right, one big picture takeaway for each of you. Where is the field of arts and health headed? What is exciting you right now about the field of arts and health? And we will start with, who's it gonna be? Who's it gonna be? Who's it gonna be?
I can
Cassandra.
start.
Oh, Alex,
Cassie,
Alex raised her hand. Go.
All right. Yeah, I think for me, I've really been focusing in a lot on policy as it relates to my research for my dissertation. I'm really passionate about how we can build infrastructure for this work. I think a lot of times, a lot of these programs are grant reliant, and maybe relying on governmental funding or foundational funding. And so trying to think about how we can create infrastructure for equitable pay for artists within these lines of work, and also for the expansion of a lot of this work as well. So that's what I've been thinking about, and using policies in other countries as models. And social prescribing, I think, is one of those avenues that we are seeing a lot of promise in. But I'll pass it to you, Cassie.
Thanks. Yeah. I mean, one of the first things that had me hooked on this field was arts prescribing. Listening to Dr. Daisy Fancourt had a little webinar. It was like a video on YouTube, but I had stumbled across it and talking about how these advancements could be made to lend people services in the community that they wouldn't normally think of as improving their health or building connections when they're facing times of adversity. So I think that this policy work and being able to have the confidence to speak with more healthcare professionals about this as well, to link and make those collaborations possible, I think that that's something that is buzzing for me all of the time, because it just proves further how beneficial the arts can be for our health and for connecting with each other, but also ourselves and understanding ourselves on a deeper level. And I think that just in general, that spread of knowledge about the arts and the arts being put on that rightful platform is what's really exciting to me. I think just a few years ago, between joining the MA and being, working in the field for a few years now, I've seen a massive jump between knowledge that people hold about the arts. And I think that that's really exciting. So the continuation of advocacy and knowledge sharing and connection between all of us.
Yeah,
Awesome.
Let's say it does grow and change so quickly. I remember not long after I started at the center, someone talking about coming back from one of the first public health conferences they tried to go to talk about the center, to talk about the arts. And the response was kind of like, oh, that's an interesting concept, right? Like, it was so new that nobody had really heard about it. And then a few years later, there would be like a line of people waiting to go ahead and talk to them about how the arts integrated with public health. And I'm having the same experience right now with disaster. A lot of the energy that I'm putting into the field is around how the arts can support communities that have been impacted by disaster. And similar experiences at some of the conferences, people are certainly interested. We're like, oh, that's an interesting concept. I hadn't thought about that connection before. But there isn't. A lot of these people are people who might be in smaller areas where they haven't even thought about arts and health, or they haven't thought about how the arts can affect their communities. But suddenly when this event happens, the arts are one of the things that's bringing their communities together. And you have a lot of arts leaders and arts council leaders who don't know anything about this and are really eager and hungry to learn. And we do have a couple of projects that we just started over in Western North Carolina. They're going to have the 1-year anniversary of Helene coming up next week. And we have a couple of organizations we were able to support with doing projects. One is doing a clay partnership between a place called Veterans Healing Farm and a clay, Odyssey Clay over in Asheville. So they're going to be working together to do some workshops in an area that was really badly impacted by the storm. And the other is kind of a county level partnership, which is really interesting. It's a senior center, an arts council, and veterans services working together to see how can they take the lessons that they've learned since Helene and use that to make all of their programming more accessible and more trauma informed, really, for people going forward. And so I just love how we're constantly seeing these new spaces that people haven't thought about before and the impact that can really have.
Amazing. Okay, we are running out of time, and we do have questions from the group. From some of the participants, I'm gonna read some. That was the nature paper, Linda, that I just dropped in the chat. So Jane asked about getting the field guide, the arts prescribing field guide, and getting how it might be used in her state. The field guide, I can answer this one, it's basically a roadmap for getting a program started in your community. And it depends on, like, it gives you case examples of how it can show up. So it gives you different examples and, like, step by step how to do it. So I highly recommend looking into that field guide and using it as a tool. We also have a webinar where the lead author talks in depth about it. I'll share all of that in the follow-up email. Then also the Epi Arts Lab, which is a lab housed in the Center for Arts and Medicine, recently this year released a case studies report about that looks at 23 different arts prescribing and social prescribing sites, programs across the country, and it gives you examples of the different ways that it can show up depending on sort of the ingredients available in your community, so to speak. So highly recommend that as well. It will also come through the email. I'm gonna jump to, so Ariana asked a question specifically to Cassandra, but I might ask for, because of time, for you guys to discuss that offline unless we can get there. Another one asks about, for someone wanting to start evaluating a hospital-based art program, resources that we would recommend. There are so many resources out there. The Arts and Health Primer, research primer that we host in January, end of January, it's a 3-day primer. You can bring your idea to this primer and come up with a research and evaluation approach. And so that could be a way to truly jumpstart it, but it's not free. If anyone else has ideas about resources that someone could use, bring it up, bring it forward.
Yeah, Natalie, this is more of like a sentiment to bring up because I think this is a really important point behind the work is that, I don't know who asked this question, if you're working alongside a specific grant looking for outcomes, or if you are just curious about your own program. But first and foremost, I would advise keeping it short and sweet so that it doesn't burden anyone in this vulnerable clinical environment as is. But also, with that being said, I think sometimes we have this notion to really, go big and reinvent the wheel or invent something of our own. And I just want to remind this person in this group that if you're just discovering something new out about a population you're working with, anything that you find is going to be new and it's going to be valuable. So if you simply want to ask people if they felt more supported because of these programs, if they felt better socially connected, some of these baseline things, feel free to keep those forms short and sweet and discover what you can from your participants. Let them answer some, questions that are Likert scale based, so you can get some numbers from that, but leave room for people to answer qualitatively as well. Let them share their heart and their stories with you to make those numbers pack a punch. So I think that that's just something in general that I'd like to share from my experience at Shands.
Yeah, and just to add to that, first of all, I love that you're supporting mixed methods, Cassie, because I think that that's always so valuable in this space to have both quantitative and qualitative data to represent this work. In the chat, I went ahead and just added this arts and health evaluation, navigating the landscape guide. It was published by UCL a bit ago, I think in 2023. And it's actually a really great launching point. I think that, like Natalie said, the primer or coming in for the intensive with us would be great to get kind of like one-on-one feedback. But if you don't have the bandwidth for that, or you're just wanting to first recognize maybe what this even is, this might be a great starting place. And it goes into a lot of depth as well.
I think it's important too when you're trying to partner to find out what that person's goals are. You can find oftentimes like health assessments for hospitals. You can find strategic plans a lot of times and really see what it is that they're looking for. I distinctly remember sitting at a meeting with a couple of hospital leaders who were talking about how what they loved about the arts programming, and one of those programs was actually UF Health Shands, was the fact that there's so many other people coming in all the time with the numbers, but the artists have the ability to tell the stories, which is so true. And that can help with public perception, which is something hospital leaders really care about. They care about the perception of their hospital. It can help with the surveys that they have. And so sometimes the impacts they're looking for aren't always about those long-term outcomes. There's other ways that we're really helping them to meet their goals. And if you can find out what those goals are, sometimes we can lean into the strengths we have as artists and storytellers to really help them in that.
That's amazing.
I could add one more thing, Natalie, to that. Heather, you just reminded me of something that's been kind of coming up in my policy work, but I think also just leans into any case making for this work, is that if you're able to find, your organization or local government's like 5-year plan and understanding, what key points they're looking for and figure out where there's alignment with what you're doing, then you might want to evaluate as it relates to that alignment. So just kind of further building out what Heather said, but I think that I've seen that strategy really play out well for a lot of organizations.
Awesome. And I am so sad to say that we are out of time. We have 4 minutes left, but there are some good questions in the chat. So I promise, as part of the email, I will send a document along that answers these questions. And I'll get feedback from the panelists on that. So you will get your question answered. It just will not be in the next 4 minutes. Instead, I would love to thank these lovely panelists for sharing their insights and expertise. It is a really exciting time in the field of arts and health, and we need more people doing it. So we had over 250 people sign up for this webinar, and over 150 show up. So we know that there is some real hunger for this work, and I hope that this got you a little step closer to feeling confident in your ability to be part of this work. I think that it was demonstrated on this panel by these panelists today that it doesn't really matter where you're coming from, as long as if you believe in the work and you're using the evidence base to support the work that you do. So thank you so much again. Thank you, Heather Spooner, Cassandra Belden, Alexandra Rodriguez, for your beautiful insights. Thank you all for coming. I'll be sending the EPIC email with all the resources. I'll be sending a recording. Is there anything else?
Thank you, Natalie, for your energy. I love having you here. Yes.
Thank you.
Second that.
Thank you.
If you can't tell, I'm very enthusiastic about this work. And if you follow the Arts and Health Today newsletter, there are lots of resources always coming through once a month, including professional development resources. If you're not, like, maybe you're not trying to get a master's degree or a graduate certificate, you just want a short, intensive experience, or other webinars that speak to this work, that Arts and Health Today newsletter will have all of the things that you're looking for. Thank you so much, everyone, for coming. And yeah, we'll see you next time. This is webinar 1 of a series, so stay tuned. We're going to dig deeper into arts and public health. We're going to dig deeper into arts and healthcare settings. We're going to dig deeper into arts and research and evaluation. So keep an eye out if those areas were of special interest to you. You can join for the next one. Thank you. Have a wonderful afternoon. Keep it classy.